Welcome to our channel, where today we're diving into one of the most important and often misunderstood topics in health: cancer. Cancer affects millions of people worldwide, but not all cancers are the same. Today, we're going to break down the difference between benign and malignant tumors, explain why metastasis is such a critical part of cancer's danger, and explore the cancers that are more common in men and women. We'll also share some fascinating facts about how certain cancers behave and what that means for survival and treatment. Stay with us as we break it all down. The basics: benign versus malignant tumors. First, let's tackle the two main types of tumors: benign and malignant. Both are masses of abnormal cells, but they behave very differently. Benign tumors are like that annoying guest who overstays their welcome but doesn't cause much damage. They stay local, grow slowly, and don't invade other tissues. These tumors don't spread to other parts of the body and can often be easily removed with surgery. Malignant tumors, on the other hand, are the troublemakers. These cancerous cells not only grow uncontrollably, but also invade nearby tissues and organs. And they don't stop there. They can travel to distant parts of the body through the bloodstream or lymphatic system, spreading the damage far and wide. Interesting fact: did you know that even though benign tumors aren't cancerous, they can still cause significant problems if they press on vital organs, like in the brain? Metastasis, the key difference. Now, let's talk about metastasis, the most dangerous aspect of malignant tumors. Metastasis is what makes cancer a systemic threat rather than just a local problem. Here's how it works. Local invasion. Malignant cells first invade nearby tissues. Intravasation. These cells break into blood vessels or lymphatic vessels and travel throughout the body. Circulation. Not all cells survive the journey, but some make it to new locations. Extravasation. The surviving cancer cells exit the bloodstream and invade new tissues. Formation of secondary tumors. They settle in new organs, forming new tumors, often far from the original site. This spread is why cancer becomes so much harder to treat once it metastasizes. A localized tumor is one thing, but when cancer cells start popping up in the liver, lungs, brain, or bones, it's a whole different challenge. Interesting fact: breast cancer cells that spread to the bones are still breast cancer cells, not bone cancer. They bring their original characteristics with them no matter where they go. How doctors test: benign or malignant? One of the biggest questions that arises when a tumor is discovered is whether it's benign or malignant. So how do doctors figure this out? Is it as simple as counting cancer cells, or is there more to it? In reality, determining whether a tumor is benign or malignant is much more complex and involves several diagnostic steps. Here's how doctors approach the process. Imaging tests. The first step often involves imaging techniques such as CT scans, MRIs, X-rays, or ultrasounds. These help doctors get a sense of the tumor's size, shape, and location. Benign tumors tend to have smooth, regular borders, while malignant tumors may have irregular shapes and invade surrounding tissues. Biopsy. The most definitive way to know if a tumor is benign or malignant is through a biopsy. During a biopsy, doctors remove a small sample of the tumor tissue to examine under a microscope. A pathologist, a doctor who specializes in diagnosing diseases, will look at the cells in detail. Microscopic examination. Under the microscope, benign tumors usually show cells that resemble normal cells from the tissue where they originated. They have orderly growth patterns, meaning the cells aren't dividing too rapidly. Malignant tumors, on the other hand, show chaotic growth patterns with cells that often look abnormal. These cancer cells may be misshapen, and they can divide uncontrollably. Malignant cells can also show signs of invading nearby tissue, which is a major red flag. Genetic and molecular testing. Sometimes the tumor tissue will undergo genetic or molecular testing. This helps doctors look for specific mutations that are more common in cancerous cells. Certain genetic markers, like mutations in the BRCA1 and BRCA2 genes for breast cancer, can give clues about whether a tumor is malignant and how it might behave. Growth patterns and spread. One key factor that sets malignant tumors apart from benign ones is how they grow. Benign tumors tend to grow slowly and remain confined to their original site, while malignant tumors grow rapidly and invade surrounding tissues. If doctors find that the tumor has spread into nearby tissues or lymph nodes, it's likely malignant. Metastasis. Finally, if cancer has metastasized, spread to distant parts of the body, it's undoubtedly malignant. Metastasis is a hallmark of malignant tumors and often confirms a more aggressive form of cancer. Interesting fact, did you know that sometimes even a benign tumor can become malignant over time? This process, called malignant transformation, is rare but can occur in certain types of tumors, like colon polyps or skin moles, which is why regular screening and monitoring are so important. Treatable and survivable cancers. Fortunately, not all cancers are death sentences. Many are highly treatable, especially when detected early. Let's look at some of the most treatable cancers. Prostate cancer. This slow-growing cancer is often detected early, and over 98% of men with prostate cancer survive for at least 5 years after diagnosis. Thyroid cancer. The thyroid gland may be small, but when it comes to cancer, most forms are highly treatable with surgery and radiation. Testicular cancer. Testicular cancer has a survival rate of over 95%, especially when caught early. Melanoma. Skin cancer, particularly melanoma, is highly treatable if detected in its early stages, with survival rates above 90%. Breast cancer. With routine screenings, breast cancer is often caught early, giving it a 5-year survival rate of around 90%. Interesting fact, the 5-year survival rate for Hodgkin lymphoma is around 87%, and many patients are cured even in advanced stages thanks to the success of modern therapies. The deadliest cancers. Unfortunately, some cancers are much harder to treat and have much lower survival rates. These aggressive cancers often spread quickly and are resistant to many standard treatments. Let's take a look at the most lethal cancers. Pancreatic cancer. Known for its stealthy nature, pancreatic cancer has a devastating 5-year survival rate of only about 10%. Liver cancer. With only a 20% survival rate, liver cancer is a serious threat, often linked to chronic liver diseases like hepatitis or cirrhosis. Esophageal cancer. This cancer can spread rapidly, and by the time symptoms are noticeable, it's often too late for effective treatment. Its 5-year survival rate is only about 20%. Lung cancer, especially small cell lung cancer, which has a survival rate of just 6% in its advanced stages, making it one of the deadliest cancers worldwide. Glioblastoma, a type of brain cancer with a survival rate of only about 5%, this is one of the most aggressive and challenging cancers to treat. Interesting fact, while pancreatic cancer is one of the deadliest cancers, researchers are exploring new treatments every year, including immunotherapies that may one day improve these grim survival rates. Cancers more common in men. Certain cancers are more prevalent in men due to lifestyle factors or anatomical differences. The top cancers that men are most likely to face include prostate cancer, the #1 cancer in men. Lung cancer. Men still have higher rates of lung cancer, although the gap between men and women is narrowing. Bladder cancer. Men are 3 to 4 times more likely to develop this cancer. Liver cancer. Often linked to alcohol use and hepatitis, liver cancer hits men harder. Esophageal cancer. Higher rates of smoking and alcohol use make men more susceptible to esophageal cancer. Interesting fact, men are more than twice as likely to develop oral and throat cancer, especially if they use tobacco or drink heavily. Cancers more common in women. Now, let's talk about cancers that are more common in women. While both men and women can get many types of cancer, these are the ones that most often affect women. Breast cancer, the most common cancer in women worldwide. Uterine, endometrial. Cancer, the most common gynecological cancer in women. Ovarian cancer, one of the more aggressive cancers, often diagnosed late. Cervical cancer, preventable through HPV vaccination and early detection via Pap smears. Thyroid cancer. Women are much more likely to develop thyroid cancer than men, especially at younger ages. Interesting fact, while lung cancer is often thought of as a man's disease, it's actually the leading cause of cancer death in women today, surpassing breast cancer. Conclusion. As we've seen, cancer is a complex and multifaceted disease, with some forms being more treatable than others. The key to survival often lies in early detection and prompt treatment, which can make the difference between life and death. Whether it's a benign tumor that's easily managed or a malignant one that's metastasizing, understanding cancer helps us all be more proactive in our health. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more health-related content. Stay informed, stay healthy, and we'll see you next time.